All right, today I am joined by Dr. Elizabeth Widen, a nutrition scientist and registered dietitian whose work focuses on the critical window of pregnancy and early childhood. She is an associate professor at the University of Texas at Austin with joint appointments in nutritional sciences, pediatrics, and women's health. And Beth's research looks at how maternal diet, weight gain, and other factors during pregnancy influence not just birth outcomes, but also a mother's long-term health and a child's growth and development well into adolescence. She has published widely on topics like gestational weight gain, maternal diet quality, and childhood nutrition, and her work is helping to shape the guidance that we as parents and providers rely on every day.
Hi, and welcome to The Weekly Parent, a podcast for people who Google everything, overthink most things, and occasionally spiral, wondering if they're totally screwing it all up. I'm your host, Dr. Kaya Duffy. Let's dive in.
So Beth, thank you so much for being here. It's so great to see you again. I know that many of us, you and I might do it, but many people are not just sitting around reading nutrition literature and nutrition journals. But we all do, as parents, live with that day-to-day, some of the questions that your research really does try to tackle. And so I'm curious, as you have started your career, what is it that first drew you into studying pregnancy and maternal nutrition and infant nutrition? Was there something personal for you, or a moment that made you really realize, like, this is it? This is the work that's important to me and that I want to spend my time doing.
Yeah. So anyways, thank you so much for having me. It's really great to be here and to see you and connect again. Well, I'm a twin, so I'll start with that.
Okay.
Maternal twin, and my twin and I were actually born rather early in terms of our gestational age. So we were born at about 31 weeks gestation, and we were both really, quite tiny at the time when we were born. And so when I was in high school, I started really becoming very interested in early infant nutrition and high-risk infants. And so I actually volunteered in the neonatal intensive care unit when I was in high school. And then I was like, I'm going to go and become a doctor. And actually, I went to undergrad at Miami University in Oxford, Ohio. And while I was pre-med at the beginning, I started to read textbooks that were nutrition textbooks in the science library. And so that kind of spurred me to switch into nutrition major. And then as I learned more about nutrition, the importance of prenatal and early life nutrition really came into light. And it just really became very, close to home for me, just because my twin and I were born rather early, and things like nutrition interventions in the NICU led us to be where we are today. And so I think it's a really, it's really personal for me, but then also very special. And then as I continued on and eventually went to graduate school, I was really passionate about global health and maternal nutrition globally. And so I worked in Malawi on a huge clinical trial. And the trial was really a drug study, but then they also added nutrition-related measures to look at how these drugs impact nutrition of mom and baby. And so that work in infancy, really focusing on maternal nutrition during exclusive breastfeeding and how that affects baby. All of that work from my doctoral dissertation actually led me to realize that what you start with around birth for babies is so important for their nutritional status and growth during infancy, but then also potentially can have really lasting implications for their lifelong health. So
Very cool. It's interesting. You may know, when I was doing research, my research really focused on later in life. But when I became a mother, I was like, hold on a second. I think what we're doing when they're really little might be important. Like, scientists and researchers hadn't, discovered this and known this for decades. But I just became aware of it. I think there's so much talk when you are pregnant about all of the things that you need to do to be healthy for yourself and for your infant. And some of that has to do with how you eat. But it's, you're eating for two, but you're not really. You need to make sure that you're eating the right nutrients, but it's certain ones, and really focus on these. And then we forget about the others, but then you've got cravings and you want to eat to satiate your
Yeah,
cravings.
exactly.
It feels fraught and complex. And I wonder what you're finding in your research about what really is critical and important for moms during that period.
Yeah. So that's a really great question. I think there's a delicate balance actually in terms of like what is really most important and then what is just like extra. So like pregnancy, so as you said, eating for two. So like your actual energy needs are not actually that much higher in pregnancy than people think. General rule of thumb is you don't need actually to change your energy intake at all in the first trimester. In the second trimester, it's thought that you just need to eat a little bit, maybe like 340 calories on average per day. And then in the third trimester, it's about 500 calories more per day. But I actually feel like talking about calories when you're a pregnant individual is making people worry too much about like meeting a certain target. And for me, I actually have kind of shifted gears away from being like, you need to eat this many calories to be like, let's really listen to your hunger and fullness cues and try and understand what they mean and actually listen to them robustly and use that to actually guide your intake. Because one thing that I think is really challenging, at least in my research, is that like I'm really interested in like this early pregnancy period and how early metabolic health in pregnancy, like what are your lipids like? How's your glucose metabolism? How much adipose tissue do you have and where it's located? So that would be reflected in like your waist circumference. Like how does that actually contribute to your health and nutritional status during pregnancy, but then also potentially your baby? And so there's a lot we actually don't understand about the physiology of how diet influences these things during pregnancy. And so it's really actually challenging to study diet in pregnancy for several reasons. So one, people in that first trimester, there's so much variability in how people feel. So like some people don't really have nausea or even cravings in that first trimester. Others, like myself, especially with my first child, like I wanted nothing to do with coffee. And then I was basically like having to have like a cracker every day before I got out of bed to keep myself from vomiting. And like at that time, I was like an expert in nutrition during pregnancy and prenatal weight gain and adipose tissue changes in pregnancy. And I was like, I'm doing my best, but all I want to eat is crackers. And so I feel like I just really focused on listening to my body and trying to not worry that much about the weight gain. And the funny thing is that like I knew by the time I was 20 weeks pregnant that I actually was going to overshoot the National Academy of Medicine guidelines, despite doing like everything correctly. I was like eating well, I was working out, I was, trying to get my vegetables, walking. I was living in New York City. I was walking all over the place. And I was like 21 weeks pregnant and I was like, oh, I'm going to overshoot these guidelines that I study. So it was really, kind of striking.
I know a lot of what you do is help to translate your research into practical guidelines and practical guidance that practitioners can use. Maybe you could talk a little bit about that. What is that like, and how are you using your research to inform what could become new guidelines?
So a lot of the work that we've done more recently has focused on trying to provide evidence for weight in pregnancy and then adipose tissue in pregnancy for relatively understudied populations. So for example, we have a paper that one of my doctoral students led looking at twin pregnancy weight gain. And so you might not actually know that like the recommendations for twins that are in the National Academy of Medicine guidelines are based on one study. And so yeah. And so since those guidelines came out in 2009, there's been like a handful of other studies focused on twins. Providers still often just recommend gaining 20 pounds by 20 weeks. And that's like the general rule of thumb. So we're trying to provide evidence that there actually is more data that could actually help make new guidelines and actually be implemented in practice.
Mhm.
Also, I work on individuals with obesity, focusing on weight loss and low weight gain, and then the pattern of weight changes among individuals with obesity and how that might influence health outcomes. So, trying to instead of just thinking about the total, looking at the pattern of weight changes over time in
Mhm.
individuals with obesity, and then individuals with all BMI categories. And then our most recent work is actually doing really intensive measures of adipose tissue during pregnancy to really try and see how weight aligns with what we think is going on with the adipose tissue, and then how that might influence mom's weight retention postpartum, particularly for individuals with a healthy weight BMI category.
I mean, maybe the assumption is fair prior to being pregnant. The idea that you are pregnant, you gain some weight, you have the baby, the weight goes away, and you just go back to your normal, typical pre-pregnancy self. And that is not necessarily the case. And I also imagine, I mean, we talk about weight cycling. Pregnancy is kind of a weight cycling, maybe not so big,
Yeah.
but there are some ripple effects of that. Like that can last a little while.
Or
eh,
forever.
or forever. Yes.
Forever in many individuals, including myself. So
Yes. I mean, and that is also wrapped up in having an infant and having less time and like an entire shift in your world, right? When a baby comes on the scene. So, I don't know, what are some of the things that you would say for parents, for moms, I think, especially women who have gone through these pregnancies, to know about the long-term impact of pregnancy weight and pregnancy weight changes?
So from what we know is that, weight gain during pregnancy and having higher weight gain, at least independent of the adipose tissue changes, is associated with having more weight postpartum, which intuitively makes sense. We also have shown with some work that I did in New York City, where we looked at high pregnancy weight gain and then the longer term effects on mom body size at 7 years postpartum. And we actually found that the effects of having too much weight gain on longer term body size were more pronounced in people who began pregnancy at a lower BMI.
Interesting.
So basically, it's some sort of like having high pregnancy weight gain is some sort of metabolic challenge, and then people are more likely to be heavier and have more body fat at 7 years postpartum. But I think that also that is what we saw on the data. But I also think that there's other things going on in people's bodies. And so the individuals who have lower BMIs when they're starting pregnancy, like their bodies might have to like shift a little bit more potentially to accommodate the growing fetus. And so they might need to gain more weight, and then their hips might be a little, just the way that their bodies might shift might be different than other individuals with different BMI categories. And so we actually don't really know about what actually happens postpartum, and people's ribs shift and things. A lot's going on there. So I do think that there are long-term effects of having too much pregnancy weight gain, but but I also let's keep in mind that it's we don't know what the composition was. Was it too much adipose tissue that was gained or not? But I also am of the camp where I'm just like, you can't control it that much. Like the actual amount that you can control when you're pregnant is very, very little, because there's a lot of things that have to happen in order to grow a healthy baby and deliver that baby um, uh, as close to term as physiologically possible for you. So, like the actual amount that you can modulate may not necessarily be that much, because your body might need to gain a lot of water. And so
Yeah.
then when we have the postpartum period, there's a lot of evidence showing that the weight changes postpartum are much more heterogeneous than I think most people think of. So, and what heterogeneity is just like we see a lot more variability in these weight changes after birth to 12 months and then even longer. And then as we continue forward in infancy, depending on whether an individual is breastfeeding or not, you're going to see just some variability in those weight changes from after you really stabilize after that initial drop, where some people will actually gain weight during breastfeeding if they're breastfeeding. Some people's bodies are like, I want to hold on to that adipose tissue, but I need more to make high quality milk. And like, that's what my body was saying to me. It was like, no, you do not, you're not able to go back to where you were pre-pregnancy. We want to hold on to these energy reserves so we can make milk. And then my research that I did in Malawi, focus on breastfeeding weight changes, just really solidified to me that there's just a lot that we don't know about what's actually driving these weight changes postpartum. Like, we know that breastfeeding is, but there's also like sleep deprivation. There's a lot of really rapid changes in hormones going on too. And then there's just a lot at play. And so what I recommend is actually for people, again, just like with pregnancy, to just really like listen to their thirst cues for drinking water and stay really hydrated. Even with whether or not you're breastfeeding or formula feeding, I feel like that's something that we all forget to do, is drink water.
Yes.
And then I really just suggest, just trying to listen to your hunger and fullness cues. And then as possible, try and be as active as you can feasibly be, given the constraints of having a baby and whether or not you go back to work or not. There's a lot of things that I think are, at play. But in terms of like thinking about body weight and health and mood postpartum, I think really encouraging postpartum individuals to be physically active, I think, is actually a really, really important thing that I think is part of the conversation more now than I feel like it was in the past.
In a number of conversations I've been having, and in the way I even think about the way that I eat and the way that I have tried to teach my kids about food and eating, part of what we can do is to encourage individuals to eat intuitively, to listen to their bodies. It's a hard thing and it takes practice, but to listen to what those cravings are telling you, to listen to what your body is saying. And without getting too like stepping into too many political minefields here, and I don't mean it to be, but I think partly that message is let individuals, it's like giving some power back to individuals to say, this is what's right for me, this is not working for me, right? That kind of intuitiveness and really, it is individualistic. And yet we have expert guidance, guidelines from trusted organizations for a reason. And they are worth considering, and they are important, and they are based on scientific evidence. Sometimes it's limited, and we can always do more and do better to build out that evidence base. But how do you think about the difference between having these really important guidelines, evidence-based guidelines, and having a space for someone to be intuitive in the choices that they're making?
Yeah, so that's a great question. It's funny because when I teach classes on life cycle nutrition, like everything that I talk about is in the dietary guidelines because it is like somewhat intuitive. And I mean, they're very similar across the lifespan with just certain foods that might be a little bit more emphasized at certain periods. Like, for example, with babies, like it's recommended to have iron-rich cereals because babies have really high iron needs after their iron stores become more depleted at 6 months. So I think that I actually think the dietary guidelines are really a useful tool for parents and caregivers, and then just for everyone to kind of see what like a benchmark is for something to aim for, and then just trying to be as close as you can to it, realizing that we're all humans and the way that they're recommended to eat in the dietary guidelines and actually eating in reality don't always fully intersect. And then I also think there's a lot with food access, and then also acknowledging that we all don't know how to cook. And so I think that there's actually a lot of opportunity to, in the future guidelines hopefully will have more nuances. And as someone who's an expert in dietary assessment, I just think, okay, yes, I'm getting my vegetable, I'm getting my protein, I'm getting a variety of different things. I think I'm actually meeting the guidelines, even though it seems like I'm maybe not necessarily.
Yeah.
So I think just kind of using it as a guide. I wanted to come and circle back about intuitive eating
Mhm.
briefly and just talk a little bit about how I think returning to that, and especially in like early life, particularly like with babies, I think is
Mhm.
really important, and I think really hard to do too. So you probably didn't see this, but there was a paper that came out recently in the Lancet about behavioral interventions for preventing obesity in young children, and basically saying that there's no interventions that really work broadly, and we need to rethink what we're doing. That got me thinking, because in my lab, we've been working for many years now on trying to actually promote what we call self-regulation in babies, where we're trying to help caregivers help babies be intuitive with their eating and really helping them self-regulate their eating behaviors. Babies, as you may know from having children, they are inherently able to regulate their intake of food. So, they will give you very clear signs that they're hungry or they're full.
Mhm.
But caregivers sometimes override these cues because they may not be recognizing them.
Yes.
And so the work that we're doing in my lab now is really trying to guide caregivers and being in tune with their baby's cues and really helping them try and maintain that ability to continue to give their caregivers those signals, and then ideally have their caregivers recognize them and then stop feeding them when they're giving those signs and not overfeeding. So we're in the lab now working on these sort of interventions, but I really think that this focusing on self-regulation in babies and fostering it might actually be addressing exactly what the Lancet article says we're missing in terms
Yes.
of behavioral interventions for
Y-
babies.
Yeah. So Beth, I'm so glad you brought this up, and we will have you back. So when you are ready to talk about your research, this line of research specifically, this is one of the areas that really lights me up to talk to people about and to think about. And I always thought that for me, one of the benefits of breastfeeding, and I chose to breastfeed, and it was really hard with my first. This is way too much information maybe to share in a podcast, but like I had bloody nipples, and I mean it took so much to
Yeah.
persevere.
That's why I'm so passionate about being supportive for how every individual feeds their babies, because
Yeah,
breastfeeding is so hard, and
it is so hard.
there's so much pressure that people have. They feel from society or people they know or their providers, this like push to breastfeed, where some people it's a lot. And the bloody nipples and the mastitis, like mastitis is an actual infection. It can be really dangerous, and I feel like it's just not as recognized as it should be. So anyway,
Yeah.
sorry I interrupted, but I was
No, that's great. No, it's true. Um, so really hard, but I pushed through eventually. It became easier, and I breastfed all three of mine. I didn't know the literature at the time, but now looking back on it, I feel really fortunate. I did not stress out about how much my kids were eating because I couldn't see. There's recommendations on what kids should eat. I really tried just to listen, and when they were crying and hungry, I would feed them. And I couldn't see that I had mixed up what I was supposed to, 2 ounces of formula or 4 ounces of formula, and there's still some in the bottle. They're supposed to eat this. And I didn't feel that pressure to get them to eat what I thought I was supposed to feed them. And so by not having visibility to how much breast milk they were getting, I felt like it made it easier for me to listen to their signals and do my best. Obviously we miss them all the time. Um, but so that's one piece, is that I wasn't aware specifically of how much they were getting, but I'm really interested to learn more about how you are helping caregivers to do that, to listen to those cues, to observe those cues, to respond to them, especially when it comes with something like feeding in a way where you can see how much your baby is eating.
Mhm. I think it's really tricky. So, and I think that there's definitely a lot of fear of food waste, particularly with food, but then also with formula as well. And, and, I, what we do is we actually show people videos of themselves feeding their babies,
Interesting.
and then we coach them on it. And so, and we give them positive feedback about what they're doing. So I think listening to babies' cues and fostering cues is really important. I think one thing that I advise caregivers to do is to just really try and let their phone down and then watch their baby and really try and like be in tune with what their baby is doing. So younger babies, when they're hungry, they will give you very clear signs. Some babies will just cry or they'll start to like wiggle when they're little, when they want more milk. But then as they get older, they will like reach for the food or point or really show an interest in your food.
Mm-hmm.
And then the signs for fullness are somewhat similar across time, where basically they'll like turn their head away, close their eyes, arch their back, move. But then some babies are much more subtle in their cues. And it's really, learning your own baby's cues. And they also will make noises. And sometimes their noises only you can understand. So I think really taking time to observe your own baby and try and understand what they're telling you will help them be more able to self-regulate.
I just want to make sure that we pull this thread all the way through. So we started this by talking about the Lancet article, that it seems like there's not much we can do to help prevent obesity in kids. But intuitive eating could be a way, and we're beginning to understand. So what is the connection between remaining, like giving our kids the tools to listen to their own signals of hunger and fullness and preventing excessive weight gain? I think you and I know it, but I want to just have it said very, very clearly.
This has more so been studied in older children, not babies. And it's called eating self-regulation, but it's also called like eating in the absence of hunger. And there's work showing that if you eat more in the absence of hunger, that's associated with an increased risk of obesity.
Okay.
A little bit later on.
I wonder if you would say that your research has changed either from your first to your second pregnancy, the way that you eat personally, or in the way that you think about how to feed your own family.
Yeah. I think my work has changed probably not necessarily the way that I eat, but I think the way that I think about food. I think it's really nudged me to be more of an intuitive eater myself. I probably wasn't as much when I was younger. And then now that I've been in the field for longer and then have really moved into thinking about like how self-regulation might motivate people's behaviors has really motivated me to be just more intuitive myself. And then in terms of like feeding with my kids, I've really tried to not worry that much about it. And so I actually, it's funny. And I talk about this with other people. I feel like once people get their PhDs in nutrition, I feel like we know about all the evidence and we also know what's best. But then I feel like I'm not as worried about it because I'm just trying to listen to my body and do my best. My son is like, will eat everything, but my daughter is very selective. She had weight loss right before she turned 2. And then we realized that she actually needed feeding therapy. And I was actually trying to be more laissez-faire about it and be like, oh, it's fine. And then I like noticed that she had weight loss. And then I was thinking about it more and I was like, oh, she only eats food that's mechanical soft, which is like very, very like easy to chew.
Mm-hmm.
And so that actually led me to get her to do feeding therapy. And now what I do with my kids, she's now much older and she is eating more variety of foods, but still more selective than I would like, but it's okay.
Mm-hmm.
But I always try to give her safe foods. And then I also try to make sure that I'm giving like a little nudge towards something that's like attractive. That might be something like outside of the box for her.
Yeah, I mean, that's very, very aligned for me. It's interesting, first your story about how it has shifted for you despite knowing all that you do about nutrition. I feel the same way. I went in to study nutrition because I wanted to know what I could do for myself. And then, I wanted to help other people have a better relationship, a different relationship with food. And as I have learned as much as I have, now I feel like I've really shifted. I paid so much more attention to it. And now, not so much. It's a little bit.
It's kind of freeing.
And it is. It really is. And I'll tell my kids, everything in moderation and connected to your how you observe feeding your kids and the practices that you take in terms of how to do that with them. Giving your kids a safe food, that is a good thing to do. We have years to influence their relationship with food. And if we are trying to push it too fast and too hard, that's not going to help anybody. And so making sure that there is something that they know and feel secure with on the table, having one alternative or two alternatives. If you're not going to eat dinner, you can have X. It makes it easier on you. They feel secure. They feel like you are listening to them, and you're not making a whole separate dinner.
Exactly.
You're just, it's something that will feed them.
We also do a boring snack if we're hungry before bed.
Good.
That is a point of contention. So usually a cheese stick, and cheese sticks, we only like certain cheese sticks.
Oh, yes.
And
Yeah.
so we're going on that journey. But I also feel like one thing that I'm going to probably do in the near future is like work with my daughter. My son eats really everything and is like, he knows what like is a normal balanced plate. He knows what he likes and what he doesn't like. And my daughter is like really, we were looking at something, and there was like some sort of infographic about like grain, protein, fruit, vegetable. And she was like, Mommy, I want that. So I think we're going to work together to talk about what is a balanced plate. And hopefully we'll see how that works out, and I can report back.
I love that idea. Yeah. Even for my 12-year-old, my youngest, over the summer when I wasn't at home as much, and they're all old enough now that they get food for themselves. And, generally speaking, we bring foods into the house that I'm comfortable with them choosing. So I don't set food limits and kind of have rules for them. But I do feel like I needed to have that conversation even with her at 12. It's like, I know we've talked about this before. You hear me talk about it a lot, but I would like to empower you. When you're home, what are some combinations of foods that hit something like a balanced plate? And what kind of snacks can you make? And how do you think about putting together a meal that is right for you? So I love that idea.
Yeah. It's my favorite one as of late.
I am so grateful, Beth, for you taking time. Thank you so much for coming on and talking to us about the science of what you do and the practical application of it. You have to let me know when you're ready to come and talk about infant feeding, and we'll have you back on. Yes? So thank you so much.
Thanks for hanging out with me on The Weekly Parent. If something you heard today made you think, laugh, or feel just a little more human, don't be shy. Subscribe, text it to your BFF or group chat, or leave us a review. Remember, you'll find free tools, downloads, and whatever else I've cooked up this week in the show notes. Check those out. Parenting is messy. Let's not do it alone. See you next time.